Okay, so we're going to apply a Volar Slab, which we use for many hand fractures, usually taken care of by the plastic surgeons, and we're going to apply it to Emma. For example, we might do it for a metacarpal fracture or a finger fracture, or even sometimes just for a tendon injury. It's generally for the hand specialist we're going to do so. First off, we're going to make sure that if we can see a ring, rings should never be left on fingers when you're putting puts on, or any injuries, just for any swelling. So always make sure that any rings or jewellery's off. Obviously if there's any wounds on there, we put some dressings on there first before we apply any plaster. So I'm going to start getting some water sorted first off. So we'll start that running, it takes a while. So various things we're going to use. Let's get some stockinette out as well. So stockinette I like to use simply because it's a nice cotton base, doesn't really irritate the skin. So I generally use this. Some people do, some people don't. I don't think it really matters either way. I just think it's better next to your skin, just because the wool can sometimes be a bit irritable. So generally with our hands, what we're going to do is always we do it from the fingertips, generally to about 2 fingers space away from the elbow. And we're going to do it what we call a volar slab. The reason why we call it a volar slab is because this is the volar aspect of your arm, and this is the dorsal aspect of your arm. Okay, so we're going to do it on the volar aspect. It's going to go on this side. Okay, so generally what we would do is get the patient to put their arm up on like that. So if you pop them in a chair, generally do it on the bed so it's nice and comfortable. Bear in mind that they do have a fracture, so hopefully it shouldn't be too uncomfortable. So we're going to apply a bit of stockinette first. Just going to tuck that thumb in. Generally just do it a little bit longer than what you want it for. Might just trim it up at the top. The reason why we do it a little bit longer is because we're just going to fold the edges back so we get a nice soft edge. So we're going to use some wool. I generally use this stuff. When you're generally putting wool on, try and make sure it rolls the right way. So when you put it on that way, it doesn't roll, so you have to pull it out. So simple thing, but make sure it rolls the right way. So generally start at the bottom, and we're just going to go around, and we're going to do what we call 50-50 cover. So generally it should do 50% over. Okay. I actually forgot to do one thing before I start. I forgot my thumb. Thank you for wiggling that around for me. So we're just going to pop the thumb out like that because we don't need the thumb in. So I'm going to go 50-50 cover. So the idea is that we're covering 50% of it at all times, and we're going to go all the way to the tips of the fingers. Should always be to the tips of the fingers should have all the slab. Okay, so we're going round, and what we're going for is well padded, not over padded, just well padded. So hopefully we've got the full extent we've got from the fingertips down to the bottom there. Generally, to get the best position, I use a roll of wool. Everybody's got different ways of doing it, but I put it sort of behind the wrist, because the whole point of a Volar Slab is in the position of the wrist is in a flex position and the fingers are backed up. I'll go through that more in a minute. And the reason why that is, it's what we call the position of function. So it's halfway between that and that. So it keeps the tendons nice and straight without any sort of contractures. So that's the idea anyway. So generally get the patient to put under there and just get them to relax the hand. Various ways of measuring. I generally use my scissors, so again you want to go from there to there, so rough like that, or you can use a bit of that, whatever you fancy. Generally with a Volar Slab, the hand specialists like it to be 15 layers. Now this comes in 5 layers, so all you have to do is triple it over. Generally, in all fairness, always use this. It's very rare you get anyone's hands that are much larger than that. Sometimes you may be, but it's a slab, it's not a cast, it's not going round, it's a position. Okay, so I would generally always use the smallest stuff. So again, we're just going to go, so 2 there, and then we're going to go 1, so that's 10 layers, 2, so that's 15 layers, and that's generally what the hand specialists like. Cut that off. Again, if you want to measure it while it's wet or dry, it's up to you, but as long as it's roughly sort of in the right positions, we're happy with that. Okie dokie. So that's that bit. We've got some hair bands to fit it on with afterwards. Next off, generally want the water. So you want it relatively warmish, not red hot, not cold. Basically, regarding temperature, the colder it is, the longer it sets. The hotter it is, the quicker it sets. So it depends how confident you are. So dip it in, bring it out. Don't try and screw your plaster out because you want the plaster on the bandage, not in the bucket. So just let it dribble, pop it on. This is when you need to work. So make sure that you've got it a good extent. And then what we're doing now is we're just rubbing it side to side. Okay, and then we're laminating the layers together. Right, I just want to tuck the thumb in a little bit, and then we're going to bring this over, get a nice edge, and then we're going to bring this over and get a nice edge here. Now, generally to get the position, what you want to do is get the heel of your hand, so you get the hand, and you want to put it in the crease there at the palm, and then you're bringing it up, you're putting your fingers on their metacarpal heads, you're pushing slightly down with this hand, and you're bringing it up, so you've got a wrist that's slightly bent back, fingers are up. So what we're doing there is just recreating that position with our other hand, with this hand here. Now I've got my fingers on our metacarpal heads, and I've just got my hand in the palmar crease, making sure that it's not going to dig in the thumb there. So again, it's not wrapping round. This isn't what we call a gutter slab that I go around. This is a volar slab, so it's just all about position. So again, and then just get that patient to relax their arm. That's it, nice, and that's it. Smooth it backwards and forwards. And as you can see, it's up to the tips of the fingers as well. Sometimes you might just want to check that all fingers are visible, so you can check the capillary refill. There we go. And then all we do next is pop a K-band. I wet mine, you don't have to. There's nothing reason for that, it's just the way I've always done it. Get the patient to just bring their arm up. And then again, make sure you roll it round. We're not putting this on tight, it's there to hold it on. So you just want to roll it round, roll it round, roll it round. And again, just come down, just over and over and over, 50-50. And then again, some people put knots in them, some people put bits of plaster on it. I generally tie it, so split it, and then just knot it on the hard side, never on the soft side. So it's not pressing on anything. And then again, just put that roll back under, and then we're just going to hold that position while that plaster sets. So again, I've got my hand in there, I'm bringing that up. So we've got the bend of the wrist back, and the idea is we're trying to get that position there. Again, you've got to be mindful that this person's got possibly a fracture, so just be a little bit careful, because obviously we don't want to cause them too much pain, but we need the right position. So the idea with that is to make sure we've got that there, and you can leave the patient there. Generally what I do as well is just do a bit of cleaning up while we're there, because you don't want the plaster everywhere. Just going to trim these bits off. Generally, plasters take around about a day to dry. They will go hard pretty quickly. And that's pretty much your volar slab. So there you can look at the position there. And the idea is that that wrist is slightly back, fingers are at a right angle, so the idea is that everything's fine there. And always up to the tips of the fingers. And as with any pot, make sure you're happy with it before you let them go home. Put them in a high arm sling, obviously with swelling, most injuries there. And then just take that off after sort of 12 hours or so. Keep it clean, keep it dry. Jobs are good.